Okay, so we're going to go through the cat vascular system. I'm going to start with the arterial system, and we'll start here at the heart. Okay, and you can see there's a really nice branch of the left coronary artery that's labeled on this particular cat. You can see that this is specifically the anterior interventricular artery, and you can see many of its smaller branches here, which is really nice. And then I'm moving the auricle of the left atrium so that we can see this vessel that I'm grabbing right now, and that is the pulmonary trunk. It's kind of deflated here, but you can see that it has what looks like a little bit of blue latex in it. And we'll look at the other cat in a minute. I think it has a little better example. Okay, the pulmonary artery would be coming off of the pulmonary trunk. There'll be another one heading over this way, which we really can't see too well. And that would be this here. It's actually damaged on this specimen because of my aggressive dissection. Okay, but that would be it right here. And then if we move that out of the way, we can see the aorta. So this portion, let me switch around this way. This portion would be the ascending aorta. And then here we have the arch where the branches are coming off. And then we'll move some of the lung material out of the way, and we can see the descending aorta here, and we could more specifically say that this is the thoracic section of the aorta as well. So remember the candy cane, with the ascending being the short part of the candy cane, the arch being the curved part of the candy cane, and the descending portion being the long part of the candy cane. Okay. Now on the cat, unlike in humans, there are only two branches that come off of the aortic arch. The large branch is the brachiocephalic artery. The small branch is the left subclavian artery. Okay, so unlike in humans where we have also the left common carotid, we only have these two branches on the cat aortic arch. Okay, and as we move the blue vessels, these veins out of the way, you can see that the brachiocephalic divides into three separate vessels. Here's our left common carotid, closest to the left subclavian. Then the right common carotid, next to the right. And then the last branch here, the third branch of the brachiocephalic, is the right subclavian. Okay, and the left common carotid, we can follow up past the veins to the left side of the neck. The right common carotid, we can follow up to the right side of the neck. And the right subclavian, we can follow over towards the right upper limb. Okay, now the left is dissected better than the right, so we'll do the rest of our arterial naming on the right-hand side, or excuse me, on the left-hand side. So we have the left subclavian, again, that's a nice long vessel that's easy to label. Hint, hint. Okay, and as we pass the first rib, it's the same vessel, but the name changes. So we would call this now the axillary because it's in the axilla, or the armpit area of the cat. As we proceed laterally, move that vein out of the way. It's again the same vessel. When we get next to the biceps, we would call this the brachial. Okay, and then as we continue to the elbow, you can see that this vessel divides into two branches. Okay, and one would be, the one on the thumb side would be the radial. The one on the pinky side for the cat would be the ulnar. Okay, veins are going to have the same names as the arteries, so we switch to the blue. Ulnar vein, radial vein, brachial vein, axillary vein. We have a very short subclavian vein. Again, we're passing that first rib, so our name changes, but there's not much length here. Okay, so very short subclavian vein on both sides. And then joining the subclavian vein, we have the external jugular vein. Okay, that's another one of the differences that we have in the cat compared to the human. If you remember, in the human, it was the internal jugular vein that was large and was joining to the subclavian at this location. Okay, these two come together to form the brachiocephalic vein. We have one of those on each side. The two brachiocephalic veins join together to make the superior vena cava. Okay, now on the opposite side, we pull some of this material up. I swing our friend over here. We should see that there's a large blue vessel coming to the superior vena cava from the posterior chest wall. This is the azygos vein. Okay, so if you're looking on the right side of the heart, that's where you see the azygos vein coming from the chest wall. If you're looking on the left side of the heart, that's where you can see the descending aorta. Okay, and on this cat, because of the way the injection worked, you can also see some branches of the pulmonary veins where you see this pink here in the lungs. Those are pulmonary veins. Okay, as we head down to the leg, remember that the pelvic area is going to be on the model, so we'll take a look at that in a moment. We'll only be looking at the vessels outside of the pelvic cavity on the cat. Okay, so our inguinal ligament is our landmark here. Once we pass the inguinal ligament, we're out of the pelvic cavity and into the leg. That would allow us to call these vessels the femoral artery and vein. Okay, as we get here closer to the knee, we can see that the femoral divides into branches. The two large branches that are heading kind of deep into the muscle here are the popliteal artery and vein, and the opening that they're passing into is the adductor hiatus. The other branches that are heading down the medial surface of the leg are the saphenous artery and the great saphenous vein. Okay, and on this cat, it doesn't look quite as great, and great is meaning long here, or extensive. Doesn't look quite as great as it could, okay, because you can see it, the latex kind of ending here, but in other cats, the great saphenous vein will extend, will be more obvious extending to kind of the mid or the medial ankle location. Okay, so this is in humans and in cats the longest vein in the body. They actually use the great saphenous vein in some cases as a source of bypass material for patients who need coronary bypass surgery.